Good afternoon and good evening to the world dental family. As Arun told, we have delegates from 27 countries and take this as great people because I love this quote. I love the Godfather movie. The great people, I have no gender partiality. Great people are not born great, they grow great. So my dear friends, today's topic is bonding with your patients, the dental panorama. So there is something, if you see the date popping in, I will just mention about the date, today's date. Even while preparing my slide, I thought something special is there. But today morning, I saw in the WhatsApp, this slide was there. This in one of the groups, couple of groups had this very unique date, 10-10-20-2020. So my PG was telling Dr. Arun that, sir, you should have requested Arun sir at 10 minutes, 10 seconds and 10-10-20-20. So I said, we will not trouble Arun. So first of all, let me thank my dear friend Arun. Thank you so much, dear Arun. These are some of the wonderful memories. If I have to talk about this man, I will not have sufficient time. So I may not finish on time and he will unmute me also. And the whole 35 minutes will be over with that. So thank you very much, my dear friend Arun, some of these wonderful memories. And let me thank all the entire team, this wonderful teamwork which I have been seeing. I have attended the full sessions, 9 to 5, 5:30 also some days. I have attended all the sessions. Greetings to the entire team WDC. That is Arun with his team members, Nashra, and I don't remember all the names. So, okay. And the judge and the panelists, the groundwork, he told me about the groundwork behind what is going on. So that was very nice. So congratulate everybody. Little about me within half a minute, I will tell you about me. That's where I come from, down south, close to Chennai. So everybody has a journey. My journey starts at KMC Manipal. Dr. Ramdas Pai, shaking hands. It was a wonderful moment for anybody. So from there, I moved to Abhishetty and then my PhD currently into the second and now moving into the third year. So hopefully finish in a couple of years. So incidentally, all three are in the NIRF ranks. One of the speakers in the WDC also, they were also talking about this NIRF rankings. All three colleges are there. Very good to know that. And these are my batchmates. And coming to this cinema, why I call cinema is, you will understand when we reach the end slide. So this movie I made, I'll tell you the background before we get into the actual today's topic. Okay, all of us know what Corona has also done some good things. Of course, there is so much happening, but some things also. The world is connected. You see this now with this, and probably we'll see this. This is the future. Probably you can see there. So the future, one of my friend also willing. So the background, why I chose this topic, my dear friends, I found some gap or lack in a while interacting with the clinical residents, the postgraduates, what we call here. So there is some lack of communication, lack of gap between the patient and the doctor. And unfortunately, many are unaware of that. So that made me look into this. Look at this slide, dear friends. Whoever has said that, whichever doctor, whichever specialist, that is not the thing, but the patient will never care how much you know until they know how much you care. I'll just tell you a small example. Recently, one of my postgraduates, Dr. Shobita Sardar, she was not well. I referred to the cardiologist. After all everything stunt placed and she comes back, sir, the doctor was wonderful. And he was so empathetic and the care was so excellent. So then there is the other side also. Once my mother-in-law went to one of the specialists for the back pain. She's 70. So I asked her after going to the lunch, she says, how was the visit and what the doctor told? No, this doctor is so bad. He didn't even look at my face. He just wrote, he took my x-ray and saw the x-ray, and he just looked at me, then wrote, gave it this, eat this, you will be fine. So these are the two ways why this is happening. So the patients, you look at this scoping review, the patient education journal. So how do patients experience caring? So these are some of the findings. So the care heterogeneous group of qualities, the attributes, the competence of the doctor, positive attitude of the doctor, and the communication. My friend was talking earlier, Dr. Shivakumar Dean, my good friend. So he was talking also in the morning at 9:30. So the positive attitudes, communication, the listening skills, the relationships. So all these are the things which the patient observes. So we should show up with energy and belief and enthusiasm to every patient. So if the afternoon patients, you say, no, I am tired, don't talk to me, just sit down in the chair and open your mouth. You can't say that. Patient will feel so bad. So from the morning patient to the evening patient, you should show the same energy, friends. That's why the successful practitioners will have this energy and this type of behaviors. So the patient, I want to tell you this, do not underestimate. The patient will listen, he will observe, he needs eye contact, and the proper body language is very, very important. My dear friends, I have attended almost around across 300 webinars, the international, national, also. I keep picking up something related to my topics. Whenever I see patient, I just jump and take a note of that. So our dear friend Sumit from University of Connecticut, he spoke on expansion. That is not the point here. What he says is, are we doing good to the patient or are we doing bad to the patient? We need to question ourselves. And my dear friends, there may be some iatrogenic effects, okay, that will happen, that we can make somehow, but he may not sue you for the bad effects. But as far as possible, we should not do any harm, or we should do minimal harm to the patient. And this is the recent thing coming up. I just want to bring it to your notice. The patient reported outcome measures in orthodontics. So the patient-focused care is increasing. Believe me that. And this is Yuli Monokaya. This is our iOS webinars. We need to respect our patients. I'll tell you why. Later you will know. The patient reported outcome measures. This is very, very important. Patient is the center of any healthcare system, and the future prompts is the mainstay in the future. So the quality indicates of patient care and safety. So the patient is a family member. Dr. Rakesh sir, he has told in his international webinar, an excellent lecture that was, he was this, treat the patient. So this, if you see this article, the patient and family-centered care is increasing. The concept has now already set in, the paradigm shift is in. The conclusion from that is the dentist is expected to have that friendliness, the respect, punctuality, communication skills, and knowledgeableness, of course. You should be updated with evidence-based dentistry. And this is also a very good article. Being an orthodontist, I pick up good orthodontic journals. This is our AJODO, the highest H-index journal for the dental fraternity. I want to just make you aware of that. So this is a good article. If you can go through, when there is time, it will be very useful. The patient expects. So with this background, I just start my presentation of today. This is my title, The Bonding with Your Patients, the Dental Panorama. Okay, dear friends, yes, you can see it here. Well, this is funny. Yes, Jerry says it is funny, but my dear friends, this is very true. It will happen to you also. Okay, that is due to over enthusiasm. The patient you will end up with patients. I'm very sure. This is a great quote which I'm going to tell you. Listen to your patient. He's telling you the diagnosis. William Osler, excellent man is the William Osler. So my dear friends, we have so many branches. The dentistry has so many branches, of us know. and so many treatments, the wide range of treatments, the technology, and the biodigital orthodontics or whatever biodigital other branches. So everything has developed so much. But what we need is, imagine a day without a patient. Can you imagine a day? But no, none of us have thought that. But we have months. We have simply locked down into our houses. Okay, all of you have felt that the day without the patient. So the patient is in focus, and somehow this part is being neglected in our busy schedules. We need to focus on patient. So this is a very interesting slide. So this is a very old movie. These two brothers. So all the Indians will be knowing, for the international faculty or international delegates, the big brother says, I have that thing, I have filter, I have suction, fogger, everything. But the younger brother says, I have patience. Yes, is right. We need patience. Okay. So the doctor-patient relationship, the communication is changing, the visual communication. I'll tell you that in the later slides. The communication is changing now. So we need to focus. And as I told you earlier, we will find such patients. Okay. Patient browses the net and comes in. Just he will tell you like this only. No need to feel bad. These are the days now, the digital days. Okay. So this is an excellent quote. So we are committed to our patients. Loyana Gidaroku from Greece, in her webinar, she has told. So the doctor-patient relationship is the most critical to the placebo effect. So the unique relationship where bonding is planned, which the ultimate objective of assisting the patient to achieve treatment goals. This is our aim. And why does it reach the excellent care, the healing process, the improved outcomes, and the doctor-patient relationship in the past? You can see here, in the past, the paternalism or patriarchal, okay, this type of thing was there. Maybe 40 years down the line, when I was small, I remember the doctors slapping me, but that is taken as good that days. If you slap now, you know what will happen. Forget about slapping, even if you put at them. So this was the doctor some 3-4 decades back, how the people viewed the doctor. Now there is a paradigm shift. Really, friends, this is our dear friend Sanjay also in his webinar. Patient what? Treat him like a friend. That's what he says. It exactly fits into the current paradigm shift. So we need to accept the paradigm shifts, and we need to go ahead and build up our patient bonding. The relationship now, this consumerism, mutuality, and the patient, they are nowadays higher education, better economic status. We need to be updated, as the doctor says here. So the trust, knowledge, regard, loyalty, some elements, I will just rush through the basic elements first. All of us know, but we need to just refresh the different elements. These are the various elements which we need to focus. The rapport, the feelings of mutual accepts, warmth. Then see here, by just shaking hands, the relationship is off to a great start. Shaking hands, that is good. The rapport you need to develop, you need to listen, you need to communicate. Okay, you need to show empathy. Okay, trust. Then only trust will develop. Then there will be and caring. Then you need to have mutual respect between the patient and the doctor, or the parent of the family. So the genuineness, be authentic and real. Okay, give them the real facts. Okay, so showing empathy is very important. The healing presence occurs, empathy is felt. So the so kind, see this, we need to be kind. We need to also not only scientific knowledge, but we need to understand the human being nature. The nature of the human being should be understood. The patient is a human being. He has his own stress, as we have our own stresses. Okay, the doctor's stresses are different. I told this in the stress and burnout lecture, which is there on the YouTube. You can just go through it. So the so kind and worried, so relieve the patient. Be patient with your patients. never patient. So my dear friend, the time you see there, if you see this hierarchy of pyramid of the patient's hierarchy needs, I will not talk about all this. We don't have much time. Arun will unmute me if I exceed time. See this the time is tip of the patient needs time. You just can't look at the X-rays or just check the facts and write down medicines and okay, you will be fine. You go and come after 1 week. Okay, there are expectations from the patients. Okay, from the other than the different other the aesthetic and functional all these things. So the communication, the doctor-patient communication, this is very, very important, very, very vital for the bonding of the patients. In the last 10 years, you see here, the USMLE, all of you know, I need not expand the testing the applicants on communication skills. This has been a very, very regular this thing in the last 10 years. And the communication process, let me not go into the details of this process. Communication process, this is just the channel I'm telling you. So that is how the communication process goes. So the communication now, it is face-to-face video. There are so many. Communication is very easy now compared to our times. So 1993, I finished my MDS. So then there is nothing there available. Okay. So the communication is now very, very easy, and you need to communicate properly. See this communication techniques, the communication techniques and effective communication. Look into the eyes before you look into the mouth. Okay. So first, just communicate with the patient. Then we need to put the patient on the chair and then start the treatments. So the doctor-patient relationship remains the keystone. The bond, this is the bond that remains the keystone for the care and the evolution. This is a very, very good article. If you find time, I want you to go through this also. I think probably Arun will tell you this. The video might be available on the YouTube. You can just mail me my details in the end of the lecture. So the doctor-patient communication skills training in mainland China. This is a systematic review of literature. So my dear friends, the doctor should support the hope of the patient to recover. Hippocrates, all of you know, he has said the patient preferences regarding age, sex, and attire. This is a very, very important aspect. The attire of the doctor is very, very important. This I keep telling regularly to my PGs, but they will give a strange look. Where is your name tag? They will like this in a blank face, broken. Gave order to the shop. So these type of things will be coming. Attire is very, very important. I'll tell you why in the next slides. And you see the synthesis, this evidence. If you see, this is one of the synthesis synopsis, which, okay, this is a very good evidence article. So Hippocrates has stated that physicians must be clean and well dressed. So the attire is very, very important. You can see here. So the clean attire, the doctors in professional attire, why the reason, okay? The professional, this is one good article, the professionalism, okay? This also you should read. There is something related to the patients. Never miscommunicate. There is a part in the article, never miscommunicate. This is a recent article. You can see the 2020 article in Ethics in Orthodontics. So the patient, miscommunication with the patient, okay? So what is your interpersonal relationship? These skills are very, very important. The interpersonal skills are really very important. So the scientific principles, the communication skills, which I have told you. So you look at this this survey. If you see here, almost around 20% miscommunicate. That is why you will not see the patient. Some of the patient dropouts. So you will be wondering where the patient went, but the patient is not happy with the communication or the bond or something. He doesn't like something. So we need to understand this, and we need to correct ourselves and go ahead with and communications skills has to be improved. So that is why there are dropouts. So the dentists with better communication skills and interpersonal skills are able to detect the problems earlier and prevent the medical crisis also. Okay. So you know the medical crisis, medical problems associated with dental. So we can prevent those such type of things also. A patient with the toothache, for example, he goes for a CT scan, that scan, MRI scan, CBCT, then lands up in your clinic. You must have definitely seen the good practice. All the practitioners have definitely experienced the clinicians. So finally, it will be a third molar crossly decayed. You just give it 100 rupees. You give an LA, remove it. Everything is fine. So that is due to the unawareness of the poor patient. Okay. So always maintain contact with your patient. The eye contact is very, very important, and you need to speak their level. So the contact, of course, the business skill and our business, for our business also, it is very, very important. The eye contact, you need to practice. This is active listening skills. This is a separate topic. This you can talk for 1 hour on active listening skills. They are both verbal and non-verbal. Active listening skills and the chair side manners. Okay, as I told you, the attire, the chair side manners, the communication, the eye contact. Keep all this in mind, my dear friends. So this is a very review on the doctor-patient communication. This also you can go through. So the dentist-patient bond, there are 4 models basically. I told you in the beginning slide, the paternalistic model, okay, fatherly figure, and the informative model, the interpretive model, and the deliberative. You can see here this, the paternalistic model, everything is under the control of the doctor. Okay, so deliberative model, in addition, I tell you my preferences, I give you facts, and this is interactive, both from the doctor and patient, both communicate. Okay, so currently this is the well preferred one, and it is happening also. If you look at the paternalistic this is paternalistic, which no more now. If you see the recent articles, it is not. So what I tell you, see this is earlier, this was accepted. I told you once, and it is equal to 1,000 times, as the superstar Rajinikanth tells, is to 100. So we need to become 10 Rajinikanths. Like earlier, this is acceptable. Now this is not acceptable, dear friends. There is a paradigm shift. We need to adapt to the different paradigm shifts. So you can see the patients are like this nowadays. Patient expects the selfie generation. I remember Dr. Sarwar's webinar. I have attended 2-3 webinars, Professor Sarwar's webinars, so excellent webinars, and he was telling the selfie generation. So that's how I got an idea, and I wanted to share it with you. The selfie generation. You can hear my dear friend Anurag Rai, and he has also. I spoke to him. He said, "Fine, Mandav sir, you can share it." So this is, you can see here. So patient asked for a selfie to the doctor. So you cannot say no, don't take selfie. Then there is failure of the bonding. Okay. So we need to adapt to the environments, the current environments. We need to adapt. We need to change. So the attire, which I was telling you, see the attire you see here, the positive. That's why I keep telling every time the undergraduates, the postgraduates, yeah, all this, the house surgeons. Okay, that is the reason you see here the positive preferences for the following: formal attire, controlled hair, and the name tag. You cannot throw the hair like that. Okay, so many times I warned my PGs, the hair is falling on the patient's mouth. Okay, so then they will remove when we go and tell, but they want to tie the hair. Okay, so these are all negative preferences. Okay, the casual attire, uncontrolled hair, and absence of name tags. So you need to keep this in mind for the doctor-patient bonding, and the patient will really love you, and the bonding will be better. That too, in our specialty and some of the specialties, prosthodontics and endodontics, there are repeated visits, and so you need to be more, bonding should be more. Okay, so for the bonding, you need to have this in mind. Why there is the communication failure is because of the cognitive failure. Okay, cognitive failure, that is the reason for the communication failure. You'll be surprised to see this slide. If you see this slide, 50% of our communication is body language. If you see this slide, okay, so only 7% of the words are spoken by you, and 38% some sounds, the voice tones. Okay, my dear friends. And the Dental Council of India, if you look at the postgraduate schedules, if you look at that, the communication skills, particularly with the patients, the council, everything is there. But the postgraduates, they don't have time to read all these things. So we need to pull it out and keep on poking them. See this, see that, see that. Okay. So this is very, very important. Keep this in mind. The communication, I will not be talking much on that. That is a separate topic. This WDC only, my dear friend Nitinjit Krishnan, I spoke to him a couple of days back. He is in Ponde. Poor patient means not economical. Please, that is unaware patient, doesn't know what he wants. This is what he said a couple of days back. He wants many times. Unable to explain the problem. He said that he believes in the doctor. So this was his lecture. You can see here, my dear friends, he spoke on visual communication. It is there on the YouTube. You can go through this lecture also. He will also mail if you request. And please read this line. All successful dentists in the world are good communicators. Okay, my dear friends, that's why I underlined that, the full red. So also my dear friend Ajit, I spoke to him yesterday. So communication is changing, very, very true. And with this corona and the coming days and the coming years, we need to accept all this, and we need to, the teleconferencing, all these things, you need to educate, so check all these, okay? And you need to check the technical abilities and the frustration points, as he said, very, very true. Thank you, Dr. Ajit. And the non-verbal communication, this is also, I told you, the more than 50% just now I have told you. So this is an excellent, somehow I cannot leave this man as so much of influence on me. This is a clip from the movie Return of the Dragon. If you see that, see how he is communicating. Don't try all nonsense with me. So there is so much you can communicate. I do this to my pages some of the times. I don't know whether they are scared or not, but they at least act scared. So I feel happy. Then they should tell me whether they are really scared or not. So my dear friends, so the requisites of the bonding, careful thinking, sensitiveness, energy, and the role of the patient, the caregiver. So this I will not talk all. They don't have much time, and there are different phases which I have just put one only. Just we have enough time to see this. So the patient has fear, anxiety. We need to understand that. Okay, there is stress, fear. We need to comfort the patient and relax the patient. Then we need to explain things. And if you look at this is called the iceberg phenomenon, the very famous iceberg phenomenon given in the 1963s. The iceberg phenomenon outside, the patient perceived need for care looks like this. But inside, if you see, this is what is happening inside. Patient perceived need. The quality of relationship is also on the decline. That's why I wanted to make you aware of this topic about my world dental friends. We need to. So there is the doctor-patient relation, the consumerist. This is there abroad. You see this. You are paid to do what I tell you. Yes, that is the attitude. But we need to adjust to this, and we need to be very, very cautious. Okay. So the poor communication, you can see there. Poor communication, we have problems. Then this is true that this was conducted by the MOSG, Madras Orthodontic Study Group. Treasure our patient as much as we do our families. Very, very true. My dear friends, the stress is very, very, is there stress? We need to stress and burnout. This is entirely a different topic. I just wanted to bring it to your notice. There is stress for the patient. There is stress. So see this. Yes, I give you the award of the best doctor for bearing with me. Yes, there are patients like this annoying patients. We should not lose patience and lose the patient also. Okay. So the patient burnout is the inability of the patient for the treatment, this thing too. So the patient had autonomy, as I told you, the paternalistic, what superstar Rajnikant slide I told you, low autonomy, paternalistic behavior. You have very low autonomy, low values. No, we need high autonomy and high values. Okay, patient's autonomy always always should be respected, even if it is absolutely contrary to the decision, the medical advice. So my dear friends, so we come to the last section of our presentation. So the bonding. So how do we bond? Bonding. How to bond? So you need to, as I told you earlier, make an eye contact properly, full attention to the patient. When you are truly concerned, just tell with your actions or with the body language or with the different communications that you care for the patients and their families, and listen till they stop and make them talk. Okay, talk, poke them, hit them, yes, the same way. Okay, nothing wrong, but be careful whom you pat. This is corona time, you be careful, no need to pat this time. So make them talk. So the real smile, yes, we are all dentists, I need not tell you, my dear friends. So the real smile one is needed, heartful smile, simple but count. See, this is what I told. So the patient is very stressed, he may not show you. Like in some of the movies, the heroine is like that inside, but outside she'll be just looking, smiling in that way. Inside like that same way. So the stress is there inside. So we need to understand that, and we need to communicate properly. And patting, yes, we need to pat you. And you are all grown-ups, you know whom pat. Okay, we are all mature enough. So the patients are not fools. Yes, very true. In the long term, we should make it count for the long-term benefits. Don't aim for short-term goals. Okay? The give time, have patience, and don't lose patience. If they are kids, you need to change your body language. Jump, yes, move. The body language should be very similar to the kids. Okay? Then only you can. And so this, yes, we need, the mobile is very important, but this you should switch it off or put it on side, or leave it aside or leave it with your assistant. Because many of my friends, sometimes when I call, the assistant will pick up. That is a very good sign. The assistant will pick up, doctor is working. I said, fine, I will call him in the night. So that is a very good thing. Then just keeping the patient on chair and looking at the mobile, that is very wrong. It gives a wrong signal. Okay. So as earlier I told you, one of our international speakers, treat the patient with respect. Very true. Without bond, they are temporary visitors. We need to bond with the patient. Okay. So my dear friends, within this 35-40 minutes, I tried to get you the best things out. I gave my best. I tried to put my heart into this. And so the carry home message for all of you, yes, this is very important. How to improve your patient retention. This is a very good article from the HODO. It is a two-part article. If you have time, if you have 2 points, yes, hello.
That's all.
So in a nutshell, see this. The develop strong professional and friendly doctor-patient bond, inform patients of their responsibilities, accommodate patients with special need patients, you need to accommodate, assume the patient may not cooperate, handle the unhappy patients. That is what I was telling you just early now. Those are the burned out patients. Burned out patients, you need to take more care. You need to have more patience, more care. Then only you will be more successful. Handle the unhappy patients with care. So terminate treatment only with justification. Be careful, my dear friends, all the legal issues. Terminate only with justification, appropriate notice and protocol. Work efficient with the best available healthcare providers and good team. You need a good team in your clinics or in the departments or wherever it is. Protect the patient information, that is very important, and practice evidence-based orthodontics. So the evidence-based orthodontics is very important. Evidence-based orthodontics is, as I told you earlier, the prompts, the patient-related outcome measures. You need to apply all the current evidence and apply it to the patient. This is the future. That is very, very important. And see here, this is still not published, but my friend Jitu has sent this. It is in the press. So our dear editor Punit will be publishing this soon. So this COVID, I want you to read this article, excellently given in this article, the orthodontic care during and after pandemic, a narrative review. Go through this, my dear friends. So see, this is what I was telling you, the telescreening and triage. This I have told my patient, my graduates, they are already following this. The telescreening you do. Then if necessary, call them, the videos, get the video, show me. This we are following now. The triage, all of you know the orthodontic age. I need not tell you that. So the conclusions, if you see this, the developing excellent good doctor-patient bond. Okay. So this is a DCA webcast. This also I was attending. That's why I crossed 300. I am telling you. Okay, I have the evidence also. More than 300 webinars. I have a book with that. I have 2-3 notebooks. So the Professor Sandesh Mayekar, that was an excellent webinar. Be clear, comforting, and empathetic. First of all, then find the best possible solution, given the willingness to pay, make no compromises, charge realistically. Yes, very, very true. Provide the value to the patient. Dear friends, keep this in mind. Excellent message from Dr. Sandesh Mayekar. So every encounter with the patient is important. Build an effective doctor-patient bond, and you need to provide some multiple payment options that is there in orthodontics. The other branches also can, I think it is there in some of the branches. Okay, so never forget. Remember this. All of know, all the dentists, all of us know in BDS final year, Andrew's 6 keys. These are my 5 keys, Mandava's 5 keys. The patient is never an interruption. Patient is your work. Everything else can wait. You will all agree with me. Greet the patient with a smile. Call the patient by the name. Okay, and the patient and all staff members are as important as the doctor. Your team is very, very, very important. And never argue with the patient. This is a very, very important thing. And be a good listener. So, as I told you earlier, listen till the patient stops. So I have seen the third generation of the patient also. So I have moved from my native place long back, and but still the patients keep coming. Okay, that is the patient bonding. I have seen the fathers, then their children and their grandchildren. The third generation we have seen, and I think my dear friend Arun also has that much experience, and all the senior. Punit by all the seniors, orthodontists, Sanjay by the patient, their webinars. I could see the bonding with the patients, and you can remember this. This is a very important line, friends. Nobody can satisfy all the patients. Remember that in life. So we need to concentrate on the rest. So the patient, take the patient satisfaction, patient feedback, and the patient gratitude. Okay, so now my friend Dr. Shivkumar sir, he has spoke about the dean. Sir, he has spoke early in the morning. So he has put a small line quoted that was an excellent one, from greetings to gratitude. Exactly what he has told is very, very true. Gratitude is very, very important, dear friends. Treat the patients with your heart. Build your practice. And one small thing I remember just now, one of our colleagues only the other day, the last month, he was telling, sir, our old student, one student called me, sir, I made an excellent clinic, and I made 4 or 5 chairs and beautiful clinic, sir, but I am not getting many patients, sir. So this is his problem. My dear friends, I'll tell you, see this is the problem. You need to talk to the senior and successful dentists and successful practitioners, okay, in your whatever branch you are, and just you can stay in their clinics before you start the practice. Stay in the clinics, observe everything. You need to observe things, then you will know. Okay, so that means there is it is not just the clinic and 5 chairs and excellent 5-star accommodation. No, because it is the bonding with the patient. Okay, that is why I chose this topic, and I wanted to make you aware of all this. So my dear friends, I thank you very much. In the end, my team of the family, thank you all, my dear friends, Dr. Gauri, Dr. Vivek, Dr. Ravi, and my team. Hello. So I would like to thank some of the team, the technology team, which has been running around, Dr. Dharani and you see Dharani, Lekha, Seshu, okay, all this have been helping me out with some of the slides, Teja. Thank you very much, dear students. And this is my tech information. Some of any questions, I feel very happy to answer you in the mails or in the WhatsApp, anywhere. Okay, so you can just contact me. Thank you very much once again. Take care of yourself and stay safe. All of you know this fellow is waiting there, so be aware of this fellow. At least another, we need to be very, very alert, at least for the next 6 months. Okay, don't ignore, just because the cases are dropping, don't ignore about this fellow. Okay, my dear friends, take care. So I will stop here. That is the end. Thank you very much, dear friends. Thank you, Arun.
Thank you so much. Thank you so much, Dr. Mandava.
Yes, yes,
The
Arun.
most colorful and most lively presentation, I think, in the whole conference. Most colorful, right from Rajinikanth to I mean, everything was covered. I mean, there was a lot of information which you gave.
Yeah.
And the most important thing is like what you said, you have sometimes second and third generation patients coming back to you, which itself is
Yes,
a
dear.
testimony of
Exactly, Arun. Exactly.
how well you manage the patients. Treatment is second. First
Yes.
thing is to make them as comfortable as possible, make them feel at home at your clinic, and half your treatment is done. And then,
Yes,
of course, how well you treat them, your actual treatment is done. So, excellent lecture. And it's a very important thing for people, because many times we see you have some
Yes, sir.
excellent academicians, the top ranking people in college, but private practice, they are unfortunately, they're not able to make it big in the practice, because the colleges as such do not teach us how to manage patients. They teach us